Some grim statistics released today. 3 out of every 1,000 people in the U.S. have died of COVID since the start of the pandemic. Now, COVID has been especially deadly for people 65 and up. About 3/4 of all COVID deaths have been in that age group. And overall, about 12 out of every 1,000 seniors in the U.S. have died of COVID. According to CDC data, COVID has been the 3rd leading cause of death in the U.S. in both 2020 and 2021. And the U.S. is one step closer to a COVID-19 vaccine for some of the youngest children. Moderna filed for emergency use authorization Thursday for its vaccine in children ages 6 months through 5 years. In today's Health Minute, Mandy Gaither has more on the just released findings from the company's clinical vaccine trial in this age group.
We've submitted here in the United States.
It's the news many parents of young children have been waiting for. Moderna seeking sign-off from the Food and Drug Administration for its vaccine in young children. The company says clinical trials showed safe protection.
When we look at antibody levels, we wanted to see levels that were similar to what we found in young adults, those 18 to 24, and that's exactly what we found. So overall, I think this is a very reassuring result and good news.
Moderna says 2 25 microgram doses of its vaccine was 51% effective at preventing symptoms in children 6 months to 2 years old and 37% effective in kids ages 2 to 6. The company says those numbers are similar to the protection provided against Omicron in adults ages 18 to 25 who take 2 100 microgram doses.
They'll obviously do their very, very thorough review, as they always do, but I think there is a general feeling to move fast.
This week, CDC data from an ongoing study of blood samples revealed as of February, roughly 3 in 4 U.S. children under the age of 18 had developed COVID-19 antibodies, indicating they'd been infected by the virus. But officials say vaccines are still critical. It's still unknown how long infection-reduced immunity will last.
You could have antibodies to a previous variant. That protection from those antibodies not necessarily as good as to a current variant.
For Health Minute, I'm Mandy Gaither.
Earlier this week, the White House COVID-19 response coordinator said it's unclear how long the authorization process will take, but they expect kids under 5 to be eligible to get the vaccine in the next couple of months.